All right, Greg, some other information you might be interested in.
What?
You need to go to the dentist. You're supposed to go every 6 months, not every 2 years.
According to my dentist, I'm supposed to go, and he has an incentive. Every time I go, I'm okay, but I generally go every 2 years.
Well, there's something new in the dentist's office that Dr. Sefton is going to tell us.
Basically a kill switch, doctor.
Yes, like a panic button. I can't believe you haven't gone in 2 years.
It's been about a year and a half, 2 years. What's the big deal? I'm fine.
That's a big deal.
I brush.
You don't know what's wrong unless they look.
That's right.
What could be wrong? A cavity.
You can find a lot of diseases through your mouth.
Oh, like gingivitis and all that nonsense.
Yeah, you're going today, right?
I heard going to get a cleaning today. Dr. Mignani, be very nice to me today.
Gum disease is like a figment of like Ultra Bright's imagination,
No,
right?
it's not.
That's a huge problem, actually.
All right.
The worst part, though, when you go to the dentist and they tell you, if you have any pain during this procedure, just let me know. And you can't because your mouth is all
Or when they ask you a question and you have all this
you're
stuff.
like, how you doing? Yeah. You can't talk.
Right.
But now, check this out. There is new technology. There is this new device that puts you, the patient, in control.
The dreaded sound of a dentist drill.
There have been times when I wish the drilling would stop.
Now, with just the push of this button, you can make the drilling stop.
I think that would be kind of good.
I have phobia, so I would completely be there and like the idea of using it.
I would love to know anesthesia's not working. I would love to know that I'm not hurting someone.
Dr. Martha Cortez is a dentist in Manhattan who specializes in treating patients with dental phobias.
50% of the population do not go to the dentist. Of that 50%, 30% are highly anxious or phobic, which means fearful.
This new device, called the dental button, is connected to the drill the dentist is using. Dr. Cortez says it's designed so patients can stop the drill if they're feeling any pain, sensitivity, or anxiety, or if they just need a break.
What happens if you're in a delicate part of the procedure and the patient stops it? I mean, could that mess you up?
When you're actually using the drill and the dental button gets pushed, there's no reflex to it. It just stops.
Kenneth Clark is about to get a cavity filling replaced.
Do you think you're going to have to push it?
Possibly. I don't know. Hopefully not, but it's nice to have the option.
Most patients won't press it so much because now you have something that gives them confidence and reduces their anxiety. They're going to be calmer.
I think it's a great idea, to instead of having to raise your hand or jerk your head, just push the button.
And if you do feel pain and press the button, the dentist can then decide if you need more numbing medication, for example, and that's not unusual. But the hope is that if you have it, you won't have to push it as often. You won't have to push it. They won't have to stop.
Some patients cannot be trusted with this kind of authority.
Gregory.
Rosanna.
Gregory.
I don't see Rosanna, she would... It would be constantly depressed.
I'm not a good patient.
Either am I.
Duke either? I could tell. A lot of flailing. Dr. Sefton, thanks so much.